I first wanted to thank everyone for joining. We have quite a great showing this afternoon. We're kicking off National Public Health Week with a panel discussion about advocacy in North Philadelphia. We have a great lineup this afternoon, including Dr. Laurie Friedman from the School of Social Work, who will talk briefly about public health advocacy. And then we'll hear from a panel of community members who currently are members of our Public Health Advisory Council. They have been with the College of Public Health in this capacity since 2018, I believe, so almost 2 years. And they're going to speak from not only their experience in North Philadelphia, but also from what they see as, some of the most pressing health issues and policy issues that we as a community can help to promote to help improve North Philadelphia well-being. So we have Luz Crespo, Marlita Milner, and Grace Marable, and they will share, like I said, their experience. And then we'll wrap up with Dr. Friedman again, talking a little bit more about what we can actually do to help advocate for North Philadelphia. So without further ado, I'd like to introduce Dr. Laurie Friedman, and I'm going to yes.
Thank you so much, and thanks for inviting me to be here tonight. I'm really excited to talk with all of you about advocacy. Really excited to be part of this panel. I got to meet many of these community board members from an earlier event that we did in January, so I'm really appreciative that we're continuing the discussion tonight. So I was asked to talk a little bit about advocacy and what that means, and really be specific. It's something I know we talk about in social work a lot, but I like to think of advocacy as not a one-time event, but rather a series of actions that we do to get someone to persuade them to do something we want them to do. So if we're not talking about policy specifically, we can think about maybe children who are asking their caregivers for an extended curfew or dessert or something like that. It's a series of actions. And sometimes we're like, stop asking. But what are they doing, right? To get them to get what they want. When we talk about public health advocacy more specifically, we're really looking at focusing on how do we get public officials to support a specific program, a policy, a law, a budget allocation, right? They're all different policies that support our communal public health, and recognizing that we're really interdependent with one another. And public health is pretty broad. And so I really appreciate that broadness because it encompasses emergency preparedness. We've seen that a lot the past year, over a year now with COVID. It talks about food, safety, hunger, nutrition, climate change, and other environmental health issues. Our public health infrastructure, disease control, international health, and tobacco control. So what I say, it's a series of actions. So what does this look like? It can be phone calls, right, to people who are elected to government, people who are in the executive department who are implementing these programs. It can be that we visit in person, we share our stories. It can be an email, it can be a handwritten letter. It can be a public comment at a local meeting. It can be a protest. It can be a social media post. It can be a petition. So there's a lot of actions that we can take to really advocate for changes in public policies. So when I think about why this is important to do, those of you who I can see many familiar names on the participant list, my newfound excitement is this concept of political determinants of health. And so in the public health world, we often talk about social determinants of health, and that 80% of our health is actually not attributed to the medical care. And it's actually attributed to the conditions and the places where we live, where we learn, where we work, and where we play, right? So our neighborhoods, our grocery stores, right? Our housing, that's all contributing to our health. And what the political determinants of health say is that every single of these one of these social determinants of health is actually influenced by a policy. It's influenced by a budget allocation, right? And so if we're gonna really change our health, we have to look at the policies that impact these social determinants. What's really interesting, I think, is to think about the connection between all the work that we do and the communities that we work with, whether we're clinicians, social workers, public health professionals. Every day we're witnessing these intricate connections between policies and the health of individuals. And I'm really appreciative that we have some individuals willing to share their own lived experiences tonight. I also think it's important to talk about advocacy because I think it's part of our ethics for those of us who are entering this line of work. So in social work, we have a code of ethics, and we often talk about Section 6, which speaks to our ethical obligation to broader society. In public health, we talk about the 12 principles of an ethical practice. And really, I'm going to quote it, but that each person in a community should have an opportunity to contribute to public discourse. And so thinking about what this can look like. I also think about that we all have different comfort levels. We all have different amounts of time. We all have different strengths. And so when I think about advocacy as a series of actions, it's not something that we have to do independently. It's something that we can do in a group, we can do with others, and really enhance our impact. And so one of the things when I think about impact and I think about advocacy is thinking of voting. And so there's research that shows that increased voter participation is actually associated with stronger mental and physical health outcomes. There was also a report in Kansas in 2016 that found the opposite, right? So there was a correlation between low levels of political engagement and poor physical health. We've also seen that communities that have higher voter turnout have increased responsiveness by elected officials. So they're aware of which communities are more engaged. And so the Robert Woods Foundation also notes that communities with high levels of civic engagement are actually empowered communities, right? They're communities that hold the elected officials accountable. I think many of us have probably experienced and feel that elected officials might come and talk with us only when they want us to vote for them, but then nothing changes in our lives. And so thinking about how do we hold them accountable and thinking of advocacy as a continuum that begins with voting, but does not end there. And so again, just emphasizing this series of events. So that was really my opening. It's what I had to get us started. So thank you.
Thank you so much. So now before I introduce the panel again, I'd like to encourage people to use the Q&A feature in Zoom to share your questions with us. And we'll make sure that we get to those near the end, but if you add them there, we won't miss your thoughts and questions. So without further ado, it's my pleasure to introduce Marlita Milliner, Luz Crespo, and Grace Marable. And I was hoping that we might first start by you all telling us a little bit about your history in North Philadelphia and your experience here in this community. And maybe Luz, you'd like to go first?
Okay, very well. I've been in this community, which is considered North Philly, Eastern North, the Fair Hill section, for all my life because I came from Puerto Rico when I was like 3 years old. So it's been more like 50 years. And I have my career, I've worked here in Philly in the same neighborhood, in the same area. And I've lived and I haven't moved out of here. So this is what I really know. You might not want to ask me about another area because I might not know that much as I know about this one. But I've worked with nonprofit community economic development organization as a community connector, and I have had put information out to the community about benefits and that they can get from the organization. And we've done it in lots of ways. And also my faith organization is in this community also, and I am Hispanic. And I find that getting information out to my community is like a little bit difficult because we have such a like diverse and more growing diverse community now, but always it's been changing. Sometimes it's a little more necessary for Hispanics, sometimes it's more necessary for Blacks. And the way it's changed now, we might have a real big mix now. And I find that handing information out, if I have somebody gives me something with the Spanish first to put to somebody, to put to the houses door to door, if I'm putting information out door to door and it's Spanish first, I don't like to put it like that because mostly English is what's spoken in this community. So if somebody sees it in Spanish and they don't speak Spanish, they're just gonna chuck it. While if a Hispanic sees it, they might have somebody that's gonna read it to them. So I see that kind of information distribution is very important for us to be aware of. How do we put information out to our community?
Thank you.
You're welcome.
Marlita, would you like to go next?
Okay. Hi, I'm Marlita Milner. I'm 69-year-old retired. I've been living here in the North Philadelphia community practically all of my life. With the exception of 10 years, I was able to live in Brooklyn, New York, where I am an ordained minister, and I worked as a chaplain assistant director in the pastoral care department at Brookdale Hospital. Before I moved to New York, I think it was 2004, I was the chaplain at Pennsylvania Hospital. Presently now, I'm in a senior assisted living building. I've been here since 2018, and majority of the seniors here, I'm able to talk with concerning health or whatever problems that we may have. Also in 2020, I am a graduate of the Women's Heart Health Association. I am a congestive heart failure patient with Dr. Crabb, one of our top doctors at Temple University, who's fantastic, by the way. And in order for us to have a support group for the seniors here, it wouldn't be that difficult, with the exception of the majority of the seniors here are bedridden. And we either have to talk to a family member concerning their health, or either we would have to talk to a nurse or a home health care attendant. Majority of the time, the social worker who's here is very, very diligent at getting us our health information, especially since a lot of the seniors are not able to get out to see what they need to do concerning their health. Excuse me, but being with this organization has been so helpful, because first, we as women in the older age don't really take care of ourselves. We're so into taking care of other people, but learning in public health what you can do for you first, then you can be strong enough to go out and help someone else. It's been a great, great communication tool for finding out what we need as seniors, having to work for so many years in a job. And then when you find yourself not able to get out and do what you need to do, you need someone to advocate for you. And as Luz has said earlier, it's good when you can be able to pass information on and have someone to read it to you. So I'm kind of grateful and thankful for, number one, being an ordained minister and passing out the good news and encouraging others. My top-notch thing is a sense of humor. Funniness is goodness for the bones. And anytime that you can advocate health and make someone else feel better, it feels great. I'm gonna tell you, at 69, I'm moving on even the more. Thank you.
Thank you so much, Marlita.
Mm-hmm.
Grace, would you like to go next?
Sure, that's a tough act to follow, but I'll try. Okay, my name is Grace Marable, and I work with Bethel Presbyterian Church. I've been a member there for over 30 years. I'm an ordained deacon there. About 12 years ago, I received like a baton to carry on their food ministry. And at that time, it wasn't very active, but I took it on and we started to build programs. And we started by preparing food bags once a week. And then we found that after a lot of people came for food bags. I mean, in the course of 2 hours, sometimes we would have like 160 people. But some of those people weren't able to use the food that we were given because they were homeless. So they didn't have can openers, they didn't have pots and pans and stuff like that. So then we went on to build another program that was on Saturdays, we prepare a home cooked meal. So the people who are homeless or the seniors who are shut in will deliver the meals to them. And then we have a couple other programs for seniors, some monthly feeding program where we take boxes of food out, and a monthly fellowship program where we talk and encourage and bring different resources into them. But we've always been about not just passing out a bag of food, but being able to talk to people. And with the COVID epidemic, it has made it more real because last year we never stopped. We was out there. Everything that we did inside, we took it outside. And that made more relationships, and we were able to talk and meet people more one-on-one. So it was really an awesome experience. We advocate for hunger and also for mental health issues and violence. So it's a very fulfilling, I don't live in North Philly no more, but when I'm working on projects, I'm there maybe 3, 4, 5 days a week. It's like I'm at home, so to speak. So it's a very fulfilling and a very busy process to be able to help people. We just believe in helping them, meeting them where they are and trying to help them, trying to get them to a better place.
Thank you so much. I think you actually segued nicely into the next question. So you talked a little bit about some of the issues that you advocate for. What would you say are the top 2 most pressing issues in your community?
I'm going to say hunger and mental health.
Can you talk a little bit more about each for us?
Okay. Well, hunger is people not being able to have enough food for them or their families each day to eat. When it gets near the end of the month, the lines get longer. People are more in need of food. And it's a big issue with trying to find healthy food available for people, because we have a lot of people who are diabetics, heart disease, or whatever. So it's not good to give them a lot of salty things. You want to try to find things that's good for them health-wise. It's not going to make their conditions any worse. Okay. And then you have the homebound seniors, which has really been a major thing with us, who can't get out. They can't get out, and a lot of them don't have family members supporting and helping them. So then we work with them to get the food, take the food to their houses, you know, boxes of food and different stuff. It's just, I mean, I've seen people, we've given out bags of food and the girls just sit right down on the street and open a can and start eating it because she was hungry, you know, and she had nothing else. So we try to help as much as we can. It's a small congregation, but we get a lot done. We get volunteers and we get support and we get a lot done. So hunger is probably the biggest thing. And then mental health, because the mental health, a lot of people suffering from mental health issues and they're not getting the treatment and the services they need now. And they're walking around and they're afraid because of the pandemic, because they see their friends dying and different stuff, you know, and they don't know what to think. But still, you have to argue with some of them to just put a mask on, you know. So it's a big thing to just be able to talk to people, to encourage them, to try to give them some hope. And we have done Fighting for Hunger, where we write the senators and the congressmen, and we invited the community members to be a part of that. And it was really a good feeling for some of the members when they got a letter back from Pat Toomey or something saying, oh, we got your letter and so, you know, maybe nothing happened, you know, but they were just so impressed to be able to get a letter back after we had fixed the form letter and they signed it. We've taken letters to Washington for Bread for Hunger. We took over 100 letters there to their meeting. We've been to Harrisburg with different state representatives talking about senior hunger, talking about how some seniors who don't have money, they're eating cat food in the cans because it's cheaper. And we just had a crying session in one state representative's office. So it's just a lot to it. And it's just some of the things that's, going on here. I'm sorry.
Thank you so much for sharing that. Marlita, what would you say are the two top pressing issues that you have seen in the North Philadelphia community?
Well, mostly in the senior building where I live in this area, which is nice town. A lot of them don't want to make appointments. They're at that prideful stage where, I'm okay, I'm all right. Mostly the males, moreover than females. And if there was some way possible, like what Grace said, if we could get out and advocate to them that they need to take care of their health problems, that they would live longer, that they would feel better. Someone would be able to talk to them about dieting, with their issues of high blood pressure and diabetes. That would be a lot helpful as well.
Thank you. And Luz?
Accessing actually, I feel, is a problem because there might be a lot of resources, be it like jobs or food or entertainment or learning situations or sharing situations. There might be plenty of that out there, but to get to the people, to let them know, like, this is good for you, this, you might like this, or what are the people really needing? What are the people really desiring? And as far as like the food, the foods is a lot of times is because depends what the people need. Some people might need bulk foods and other people might need smaller portion stuff. So if only thing out there is the big portion stuff, all the ones who need the little portion stuff, I say, oh, no, I'm not going to go take that because it would be a waste. So it's like trying to, how to let the people know what is there for them.
So getting the information out so that they can access the services that are available.
Yes.
Yeah. Okay. There were a couple of questions that have come in. Somebody has asked, do you find that distributing information in your area of North Philadelphia is challenging? Why or why not? And what are your current distribution channels?
In my case, we do flyering, we do email, we do newsletter. There's like quite a few channels, but I find that a lot gets put out, and maybe people are receiving too much information from too many things, from too many resources out there of all different things. So a lot gets overlooked. So I don't know if it would be like prime time when to put the information out or like what, but I do find it challenging.
Thank you. Marlita and Grace, would you like to address that question?
Okay, living in the senior building where I am, we have a newsletter weekly that goes out to each and every apartment. There are like 300 units here in 2 buildings. And before the pandemic, we had a lot of programs where you were able to come down and participate, but a lot of them didn't feel as though they wanted to participate. But in the newsletter was a lot of information that they needed concerning food, health resources. But like Lou says, sometimes it's too much information and you don't want to read it. Because I know myself, if it's a lot of information, I'm gonna say, oh, I don't want to be bothered with that today. When you're a senior, it's a little bit different than when you're younger. You're younger, you're gung-ho, you want to find out, you want to go and do. And after working for so many years and you get to a point where your bones and your mind don't line up line up together. You just don't want to be bothered. You want somebody to tell you something and then you'll say, oh, okay, I'll think about that. As a senior now, me is a different person. But someone who's maybe like in their 70s or 80s and have real bad health issues, they're not going to want to read. They want someone to tell them, you know, well, this is happening. And they'll say, okay, well, if you could write it down and remind me of it, I'll be okay.
Are there certain people that are most trusted in your community?
Yeah, I would say our social worker. You can come and talk to her 24 hours or whatever the case may be. I'm one of them. If you need to talk to me, all you do is call the office and they'll call me and give me the number, and I'll call the resident and talk with them or whatever they may need.
Thank you. Grace, did you want to answer that question too?
There is, on some items, there is a lot of information and people don't take the time to read or want to read. And some of them I find they can't read because there are people that come that can't even sign their names. But if it's something really important, you have to focus on it and you have to stay with them on it and try to keep talking to them, reminding them, you know, have you signed up for your flu shot? Have you got your vaccination or whatever? But you can't give them a lot of information at a time because it won't work.
That's right.
So in many of our conversations as part of the Public Health Advisory Council, we have talked about issues around hunger and about mental health. Some of the more specific discussions revolved around the 302 policy. And I'm not sure that everybody is aware of what that policy is. So I don't know if one of you might want to talk about that in regard to the mental health response calls.
Well, I know a little bit about it, and only because a family member of mine was recently 302. But
what does it mean to be 302? Maybe we can start.
Well, it was my sister. They said that her daughter felt as though she was going to hurt herself, and she called some agency and they came and got her and took her away. Okay. And I think it was the best thing for her, okay, because she needed help. But on her own, she wouldn't go and get the help that she needs. So now that they have her, you know, enclosed in this place where she can't leave, now they can try to help her. A lot of people that we see on the street in the community when we're working who have mental health issues, if there's an incident and you call the police, they're not prepared to always handle it, you know, even if you say this person has mental issues. So you're a little nervous about doing that because you don't know how it's going to go down, you know. So I know we had before a counselor or someone on staff who would come in and talk to people and get them in the right direction and stuff. So that's one thing that's needed in the community, to have more people like that to be able to come out and talk and help people and get them, you know, the care that they need.
There was another question that came in. How has your community handled the pandemic?
I can say.
Sure.
Being in our building, in our assisted living building, the newsletter that would go out would tell you to keep your distance 6 inches apart, wear your mask. We weren't allowed to walk around the hallways without our masks. If any resident would smoke or anything, you have to be 20 feet away from the building. If there are any issues that were really important, like gas, you didn't have, we have electric heat. If you had problems with your plumbing, if you had problems with the electricity, the major problems, which they handled immediately, anything else like a light bulb went out or something like that, they would take care of that later. But mostly the main issues that were concerning, our social worker was very diligent at seeing to that we had enough food. She would make an announcement on the loudspeaker, residents, if you want to come downstairs, keep your social distancing, make sure you wear a mask and bring your shopping cart or a bag to carry the food that was being distributed. At least it was twice a week, especially when we had the shutdown. And there were not allowed any visitors with the exception of your home health care worker, a nurse, or a doctor, or if the pharmacy was sending over prescription. Now they're opening it up a little bit where you are allowed one member to visit, but you had to sign in and your temperature taken. You had to have your ID, but you had to be out of the building by 7 o'clock.
Thank you. And just to clarify, it's 6 feet, right? Social distance.
6, what did I say?
Maybe
6 inches.
20.
A little close for me. I think.
I'll be all right.
Okay. I would say we have a very serious drug abuse situation in our community, and it's medical drugs and street drugs, and it's been for the longest where I think it even gets like overlooked or just accepted. And but even though drug users, I see the street drug user people all with masks, so I feel that yeah, the community is trying to protect themselves. That's not the way they want to go out with the pandemic, but maybe they're not caring too much about another way. But the community seems to be caring about the pandemic and doing what has to be done. And they're taking the vaccines, or, at least trying to find how can I, when is my turn going to be? And they were doing the testings when there were testings out there if they felt they needed. But I think with the testing, maybe people were testing unnecessarily without even thinking they had symptoms or anything. They would just, I'm going to go get tested. So that needed to be controlled a little bit.
Do you think that was from fear or misinformation?
Possibly. Or just the not knowing, like maybe I have it and I'm not feeling anything, so let me just go get checked.
And how was it to actually go through the process to get testing scheduled? Was there,
No, there were a lot of just come in
okay.
situations, so people would just go take advantage of it.
Mm-hmm.
But which for myself, I saw as like, I'm not going near there because it's too many people might have it. Then I'm putting myself in a bad situation. So that's the way I saw it.
Hey, Grace, do you want to talk a little bit about how your community has fared in the pandemic? And I guess I would also ask all of you, if there were certain issues or things that were, made a lot worse as a result of the lockdown and the pandemic.
Well, I don't think everyone in the community handles it well. A lot of people seem to be in denial until it gets to the point where their friend that they was with every day disappears because they're born, and they weren't. I still see in our community, I still see people gathered together on corners socially without masks on, and they're people our age, Marlita, not young people, and I just can't believe it. Every week we give out masks. When you come towards us, you'll have a mask on. Stop. Here's your mask. So it's not. It hasn't been really good. Some people, I think, still don't believe that it's true. I don't know what more we can show them, but it hasn't been good. And people just, I think the times when they were really asked to stay inside, it seems like everybody's mind, it affected everybody's mind, Everybody was just a little thrown off and confused with that. So once they got a little leeway to get out, they just went for it, doing different things.
Thank you. There was another question. How do you or your communities support people with disabilities? If some people can't read, how do we get information to those groups, and how can they sign up for services if they don't understand what they're reading?
You have to read to them. and explain it to them. Sometimes it's an issue with us occasionally, not too often, because we get Asian people, we get Spanish people, and we have one volunteer who's Spanish, and it's really great when she's there, but she can just run with it. But a lot of people, we have to just read for them, and we have to sometimes sign papers for them, like some of the paperwork that has to be signed, which is acceptable now with like share and different stuff. So you just have to help them.
And Luz and Marlita, have you had similar experiences in your communities?
I believe in volunteerism. Like if a person should have the heart that, oh, let me see how best I can help this person. Be it whatever situation, wherever it arises, to help a person understand, be it the voting process, be it the language problem, be it what it be. So I'm for one that I will stop. And I've been with other people that they're like, why is she taking so long? But I will take the time to listen to the person to see what it is that they're not understanding and if I can help them or not. So I think it takes like stop, pay attention, and then see what you can do, which that's individual. But there are like ways where papers are given in languages that are out there, the language, and sometimes just wording. The wording is changed so that the public that we think we're going to reach will understand it. So all those things are done so that people can understand what they're trying to get.
Okay, thank you. Couple more questions, and you kind of talked about this a little bit, but how are the different organizations in your community addressing social isolation? So for people like Marlita, you mentioned that there are some seniors who can't leave their apartments. I think Grace, you mentioned something similar. So what sort of efforts are being made to help those individuals?
Well, some of the seniors who are not able to come out their apartments have either a home attendant or a nurse. Some of them don't want to be bothered, period, because they're angry. They're older seniors, and it does take a lot of patience to explain to them what's going on or what's needed, and this is why it's needed. And as Lou said, it does take a lot of patience. We have a lot of Chinese, and we have a couple of other diverse people in the building who don't speak English too well. And it takes a lot of patience because my neighbor across the hall, he's Chinese, and his home attendant didn't come in, and he went to the doctor and he didn't understand the English, and he asked me to help explain what was going on in the paperwork. So I was able to tell him by hand language, and he understood, to call his doctor and make an appointment. And then he was explaining it to someone else that came on his floor that was Chinese, and they explained it to him the same way. So like Lou said, sometimes it takes patience and be understanding a little, sometimes you have to weigh out what the person is saying in order to help them, be more helpful.
I like to say that by having to be isolated, a lot of people still have not come out. They're still homebound, and we don't even know like who is in there, and it's not really having people to be with to help them. We don't know how many people might be shut in.
Right.
Yeah, I find that because of the isolation, we send out gift baskets, we send out cards. Like Easter, we just sent out cards to some of our homebound seniors. We go and deliver food to them if they need it. We just make that extra effort to contact, to give them something, a phone call. Everybody take a person and call them once twice, every week or two, if nothing else. Just make some kind of contact. And you find people want to talk, or they just go on and on and on and on. And that's from being isolated and loneliness.
Mhm.
Mm-hmm.
But I've gotten mail like from the state representative and other organizations around that, and even temple stuff that gives me information that I can use out there, and it comes to my house.
I see. Okay, so and is that like intentional? So they're sending it to you because they know that you're sort of in close ties with your community?
No, they're sending it to me personally
Okay,
as an individual.
gotcha. Have you noticed any significant or worsening food insecurity as a result of the pandemic? In the middle of what's happened with COVID, has this been a worse problem?
I have
Like
seen
you
waste.
said.
Waste?
I have
Yeah,
seen
some
waste.
waste.
That bothers me a little bit. Like,
Yeah.
oh God.
It's waste and people wasting food. It's waste and being given things that they don't understand how to use it, to cook it. They're not familiar with. You see that also. I'm sorry.
So like given some vegetables or something that they just are not
They're not
familiar with?
familiar with. If you gave somebody an eggplant and they never ate eggplant, so they don't know what to do with it,
Mhm.
So
And
then that's gonna be wasteful, And then
sure,
yeah,
sure.
like a lot of the seniors that were shut in when they had those lives, and you could come here on this day or that day and get food, but they can't come out, so they weren't being covered for, provided,
Mhm.
that you have somebody to come to them and bring them stuff.
Somebody has asked for you to talk a little bit more about police relations in your communities and in respect to mental health issues. What would you like to see in terms of community relations with the police?
Well, we had, before the pandemic started, we had a community meeting that we had, I think it was like once a month. And the police community relations officer did come to the meeting, and the captain of the district came also. So whenever I'm doing something, a lot of activities, I will send information to them so that they know what's going on at our location. So we would like to see them be more active, show up sometime or support some of the things that we're doing.
And
Well,
oh, sorry, go ahead, Luz.
myself, I would prefer not to need the police because sometimes I feel like I'm the criminal whenever I have to have an officer approach me, whether something happens to me or not. I feel like, oh gosh, they're, and the way they just start speaking to you. And if the majority feel like that, that's a very sad situation.
Mhm.
And I think a lot do, because people don't tell me too much that they want to be with the police or stuff like that.
Mhm. So how would you like to see things change? I mean, Grace, you said that before the pandemic, you used to meet once a
Yeah.
month. Has
We
that
was reaching out,
continued?
to the community and different people to work together to make the community better.
Mhm.
We have a guy that's a member of our church who's a police officer, but it's another side, and a lot of them want to help and be a part of things that's going on.
Mhm.
Yeah, but I'm sure that they must feel kind of in their own way threatened, the way the crime is out there and the disrespect,
Mhm.
so they feel threatened too. So they come with that since they are being disrespected, they come out like with the self-defense mechanism. So I think that maybe they can have some kind of like sessions for them or something to help them to, deal with these, hard feelings that come. And I think they're working on kind of the training differences. They're trying to train a little different with a little more concern.
Mhm.
So I expect something could change.
Okay. How do you think the news media might be able to help better advocate for your communities?
They come in and see exactly what's going on. If they visit some of the different food pantries, the senior places, and see the activities and the services that's being provided for the people. And so that's a feature story. It could help. I think.
Yeah, if they could be in the streets and feel the feeling of it.
Yeah.
Like feel the feeling of what it's like to be surrounded by all that's going on,
Yeah.
the good and the bad. And then they can use their words adequately, because a lot of times I hear the news and I'm like, why are they using those words? Like, I don't like the way they're using that word. That's affecting like me personally. Like if I'm like that too, like they're making it a whole. So I think the media needs to really know what's there.
So when you say using the words, I guess maybe, can you explain that a little bit more? Are you referring to some of the instances maybe when they've been rather negative about the community? Or is it something else?
Or stigmatizing words that generalize and say and like maybe just like say that this is how that person is. Well, you don't know, you only know what happened. You can't say that person is that type of person because that happened. So like I think they stigmatize. Like,
so maybe just being more careful with their words and in them and experiencing life in your communities.
Heather?
Yes, sure.
I'm thinking if their communication would be a little bit more wider, as Luz was saying, they really don't communicate too well with our community. And what they really need to do is really sit down and talk with someone that's out there in our community to find out really what's going on. And this way they'll be able to word and see things a little bit different. Communication needs to be more between us and the news media.
Okay. And somebody has the two last questions, and then we'll turn it back over to Laurie. How has vaccinations been going within your communities? Have you had or heard a lot of pushback about receiving the vaccine, or some hesitancy among members of your community to getting vaccinated?
Well,
I've heard more for it. I've heard more for it than against it.
Especially in our building, the social worker has been very cooperative in letting us know where we can go out and get it. Those who could not go out, they would have a social service organization come in and give out the shots, or in the beginning gave out the testing for those of us who weren't able to go. But there was an information in our newsletter saying, in the beginning, when you were able to get the shots, to go where. Across the street is a school, and also there's a church across the street. And then about 2 weeks later, they had organization come in and give out the shots, and you had to register for it.
Okay.
Yeah, and I think they're feeling special that they are getting vaccinated, like they're giving them lollipops.
Yes.
Sorry, go ahead.
So in your view, what can we in the College of Public Health and in our larger Temple community do to be more supportive of your community and have a meaningful, positive impact? What would you say that we could do to help?
as I has said earlier, can I go? Is it all
Sure.
right? Have communication more. Have someone from Temple Public Health come in and talk with the social worker and set up a meeting with the seniors to see what Temple University Public Health has to offer, what the hospital has to offer, what services are available. So a lot of the seniors who are not bedridden or whatever don't have to take the bus to go, you know, way over media to the doctor, or have I forgot what I used to take, they used to come and pick you up to take you to your doctor's appointments. Maybe we could have some type of collaboration with Temple Public Health and the health services that they offer to make it more convenient for the community to, you know, to be a part of Temple.
Luz or Grace, did you want to add to that?
Well, basically the same thing. Just definitely come closer, come out and see what's going on. Get the feel of the community, and you can see what they need, the community members need. And then we can work to see how we can work together to address some of those issues.
Along that line, I feel that they should come personally to the one person that's going to put it out, not like through email or this or that. Like, talk personally to the person that's going to put it out, because that person will have more feel of what they want out of that person that's talking to them. Like, they can share together.
Thank you all so much for your thoughtful responses, for being here today, and for being part of the Public Health Advisory Council. There were a couple more questions, so if we have a little bit of time at the end, I'll make sure that I get to those, but I wanted to give Dr. Friedman a chance to wrap things up by giving us some ideas for maybe what we can do to be active parts of our larger North Philadelphia community and advocate for things in support of the community at large. Dr. Friedman?
Thanks so much. I'm not sure how much more I have to add other than to reinforce. I think I kept scribbling notes as I was listening to all of you, because that's helpful for me. But I think listening, comes out, that there's so much knowledge and so much positive going on in these communities, and to listen and not make assumptions, because I think a lot of times our role, at Temple, is to support the work that you all just talked about, right? And not to make assumptions as to what is the best way to do something. So I think listening for me stands out. I think relationships, we have to build relationships with people, and the trust, and being able to share information that we have, and to listen to information that community members have, and how do we really work together and do that in a genuine way. Because I think that's really important, that relationship piece. And then communication. I think you all highlighted that, we all communicate differently. We all have different priorities. I know in my own experience, I thought it was really interesting, and you were sharing earlier, like, some people want to read details, and some just want to know what to do, and to trust someone that I trust that who has that information. And I think that's really important, to be able to adjust our state, or what we're saying, to different audiences. And again, that listening and relationship piece, I think, ties into effective communication. That communication, I think, is a lot harder than we think. And so when I think about how many emails I get, or flyers that I get, or whatever that looks like, and so to think through, and I've often read, and we talk, it takes 7 times that we hear a message before we believe it or we listen to it, right? And oftentimes from different people. And so to recognize that if we're hungry, if we're, if we're struggling, if we're concerned about family members, it's even harder to process that information. So I think when I think about advocacy, those are the 3 pieces that stand out to me. But I also heard, if we're talking about investment in communities, and the connections, right, between food insecurity, between hunger, between waste, between mental health, they're all connected. It is a lot harder to take care of ourselves if we're struggling how to get food on the table, or how we're going to feed our kids. And so I think that things that we can do is really make sure that these stories are heard by people who have the power. I'm going to come back to budgets, but where do we choose to invest our money and our resources as a society, right? And as a city as a whole. And so making sure that our elected officials know that we're paying attention, that we are sharing stories, that we're advocating, that we're writing op-eds when the media talks about someone in a way that's disingenuous. I think it's important that we really, we have a voice as well, and that we use it in partnership. So I think I heard a couple of people say, elected officials, there's a lot of resources also in the government. So I'm a big advocate of choosing, a lot of them are on social media. So do we follow them on social media to see what they're doing? Do we go to a town hall or a monthly community meeting? Some of them send paper newsletters, right? And we can pick and choose, and we can also tell them how we prefer or what a better way is to communicate. Because I think that it's really important to that they work for us. And how do we hold them accountable to do that? And that doesn't get lost. So I think we can share that information as well, and facilitate that. So I think that's what stands out to me as I listen. That's what I heard in January as well. And I know a lot of our conversations, I know Lou's with us in the past, is that, how do we really work in partnership? And we can't just, again, I would come back to advocacy isn't a one-time thing, but it has to be a continued relationship and partnership that we don't just come in and leave, but how do we really work together? So I think that's what I would say as I listen to you all. So thank you for inviting me.
Thank you.
Thank
There is
you.
one last question, one parting word of advice. So somebody anonymously has asked, as a future public health leader who wants to advocate and work for underrepresented communities, what would be a word of advice from your own experience that would make the world a better place, and so that future public health leaders can be better allies?
Follow up on me.
Stay connected.
Yeah. And be more patient. Be kind to one another, tenderhearted and forgiving one another. Just be
Yeah.
patient.
Have
Thank you
compassion.
all.
Yeah.
Sorry, I'm so sorry, Grace. What were you saying?
That's okay. You have to have compassion. You have to feel it. You have to go out there and see it and feel it to understand what's going on.
Thank you all. Thank you, Dr. Friedman, and thank you all for attending the first event of our series for National Public Health Week. We really look forward to continuing this discussion about advocacy throughout the week, and we hope to see you at our future events.
Thank you.
Okay.
Okay.
Thank you. Good night.